Today we're talking with Dr. Jung E Park, a neurologist specializing in movement disorders. We'll discuss not only Parkinson's disease and tremor, but also talk about how new technologies like artificial intelligence may change neurological care. Many people think Parkinson's disease only affects older adults. Can younger people develop it also?
Yes, they can. Although Parkinson's disease most commonly develops after the age of 60, some people are diagnosed in their 30s or 40s. We usually refer to this as young-onset Parkinson's disease. In younger patients, genetics may play a role, so depending on the person's age, family history, and clinical presentation, we sometimes recommend genetic testing. That being said, most young patients do not have a single identifiable genetic cause. Parkinson's disease is usually the result of a complex interaction between genetic and environmental factors. The important message is that age alone should never prevent someone from seeking evaluation if they notice symptoms such as slowness, stiffness, or tremor.
A lot of people worry that shaking hands automatically mean Parkinson's disease. When should someone seek medical attention?
That's an interesting question. Fortunately, not every tremor is a symptom of Parkinson's disease. In fact, one of the most common causes is essential tremor, which often causes shaking of the hands while holding objects, drinking from a cup, or writing. It's very common and can run in families. Not everyone with a tremor needs an MRI, extensive testing, or medication. The first step is simply determining what type of tremor it is through a neurological examination. If the tremor is mild and doesn't interfere with daily life, treatment may not be necessary. On the other hand, if it's making it difficult to eat, write, work, or enjoy everyday activities, then medications or other treatment options may be helpful. Every patient is different, so treatment should always be individualized.
Professor Park, artificial intelligence is advancing rapidly. Do you think AI could one day diagnose tremor or Parkinson's disease at home?
I think AI has tremendous potential, but I don't believe it will replace neurologists in the immediate future. Researchers are already developing systems that analyze smartphone videos, wearable devices, and voice recordings to detect subtle movement abnormalities. These technologies may allow us to monitor patients more frequently and even detect changes earlier than occasional clinic visits. However, diagnosing movement disorders isn't just about measuring how much someone shakes. We also evaluate muscle tone, walking, balance, eye movements, and speech. We also take into account medical history and medications. I see AI as a tool that can be useful rather than a replacement. It can help us collect more information between visits while physicians continue to integrate all of that information into an accurate diagnosis and personalized treatment plan.
One thing many patients notice during a neurological exam is that they are almost always asked to walk. What is the reason behind this?
The Gait exam is an important and valuable part of the neurological exam. For example, someone with Parkinson's disease may have reduced arm swing, smaller steps, or difficulty turning. Other neurological disorders may have completely different walking patterns. To neurologists, watching someone walk is almost like listening to the heart with a stethoscope. It provides valuable information that often cannot be obtained from imaging studies alone. Sometimes just watching someone walk across the room gives us important clues about what's going on.
Many viewers may have seen Parkinson's disease portrayed in movies or documentaries. Are there any you could recommend?
A classic film that many neurologists love, including myself, is Awakenings, based on the work of Oliver Sacks. Although it focuses on post-encephalitic Parkinsonism rather than typical Parkinson's disease, it illustrates the remarkable history of levodopa treatment and the profound effect neurological diseases can have on patients and families. Another well-known movie is called Still, a Michael J. Fox movie. It offers a very honest and inspiring look at what it's like to live with Parkinson's disease over many years. It doesn't ignore the challenges, but it also highlights resilience, family, and maintaining purpose. Lastly, an excellent film I would like to recommend is A Late Quartet, in which a world-renowned cellist is diagnosed with Parkinson's disease. It beautifully portrays not only the physical symptoms, but also the emotional and professional impact of the diagnosis. Perhaps the most important takeaway from these films is that Parkinson's disease is much more than a tremor. It can affect movement, sleep, thinking, balance, and many aspects of daily life. Fortunately, we now have a wide range of treatments that can help people lead active and fulfilling lives.
Professor Park, I have a random question. When people hear the word Botox, they usually think about cosmetic treatments. How is Botox or botulinum toxin used in neurology?
That's one of the biggest misconceptions. Botulinum toxin has been used in neurology for decades and has become an established treatment for several neurological conditions. One of the most common is chronic migraine. For people who experience headaches on more than half the days of each month, especially when medications alone haven't provided enough relief, Botox or botulinum toxin injections every 12 weeks can significantly reduce the number of migraine days. Many patients experience about a 50% reduction in headache frequency, and for some, the improvement is even greater. We also use botulinum toxin to treat conditions such as cervical dystonia, hemifacial spasm, blepharospasm, and spasticity after stroke. So while many people know Botox, quote unquote, from cosmetic medicine, it's also an important treatment that can greatly improve the quality of life for neurological patients.
And finally, what message would you like to share with people who may be worried about tremor or Parkinson's disease?
I would encourage people not to immediately panic, but also not to ignore persistent symptoms. Not every tremor indicates Parkinson's disease, and not everyone with Parkinson's disease develops tremor. The good news is that many movement disorders are treatable, especially when they're recognized early. If you notice ongoing tremor, slowness, stiffness, changes in walking, or other neurological symptoms, it's worth being evaluated by a neurologist. An accurate diagnosis is the first step towards effective treatment, and we're here to help patients navigate that journey.